Closed session.
Whereas the New Kent County School Board has convened a closed meeting on this date pursuant to an affirmative recorded vote and in accordance with the provisions of the Virginia Freedom of Information Act. And whereas Section 2.2-3711 of the Code of Virginia requires a certification by the New Kent County School Board that such closed meeting was conducted in conformity with Virginia law. Now therefore be it resolved that the New Kent County School Board hereby certifies that to the best of each member's knowledge, only public business matters lawfully exempted from the open meeting required by Virginia law were discussed in closed meeting to which the certification resolution applies, and only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered by the New Kent County School Board.
Thank you, Mr. Mead. Do I hear a motion to approve the certification of the closed session?
I move we approve the certification of the closed session.
Thank you, Ms. Barber. Do I hear a second? Thank you, Ms. Gaskill. And a vote? Aye. Okay, good evening, everybody. Welcome to our January 24th work session, New Kent County School Board. Second item on the agenda, Dr. Nichols, responses to citizen comments.
Thank you, Ms. Winford. I do have a few responses to citizen comments. A number of the comments last meeting were about mask mandates, which we're going to address, well, we addressed last week with a series of emails and communications, but we have a presentation specifically about that tonight. So I'm going to let the presentation speak for that piece. What is the status of Poet X book at the middle school? Mr. Miller, Ross Miller, is going to do an update on, sorry, Ross moved off to the side. He's going to do a library update a little bit later on. The Poet X right now sits at the division level for review based on the new standards that we put in place, including parent consent. So Ross Miller is going to talk a little bit more about that tonight, but that's where it sits based on the new protocols that we have in place. So we had a couple questions about draft minutes, and it was about who made the decision to omit the minutes and where did you make that decision? So the honest truth of that is the omission was due to it not being part of the original agenda. It was not in the original agenda as a motion. This was the motion to allow the board chair to cede comments at the board chair's discretion. I know I didn't say that exactly correct. When the draft minutes came out, that motion was not in the draft minutes. It also, we were transferring over board clerks between Ms. Miller Hall and Johanna Davis, who's done a wonderful job on our minutes. It was on the YouTube. It is part of our minutes that you vote on. So that is really the end of that one. So we had a question about COVID guidelines. We'll cover that more tonight too, because that continues to change. Had another update with the health department late Friday with evolving recommendations. Yes, SEL second step curriculum and limited access to the curriculum. Because of copyright, we cannot post it, but you can see it anytime at the middle school. That's the big piece on that. We are working on a report that's upcoming. Unfortunately, it is not on tonight's agenda for the work session. So we'll get you more information around SEL. If you're following changes at the state, it's a very interesting time in education. We do expect some changes with SEL, and we'll combine that with where we are in the changes that we're making as well. So that's coming forward. Actually, following legislation, there's a bill specifically about SEL in schools. So a lot of shifts and change coming our way. So, Madam Chair, I believe that concludes the citizen comment pieces, specific questions.
Okay, thank you, Dr. Nichols. Board members, any comments or questions for Dr. Nichols? Okay, thank you very much. Next on our agenda, item number 3 under new business is a calendar update, which I know a lot of people are looking forward to for 2022-2023. Dr. Nichols, this can be you or Mr. Hoffman?
We're going with Mr. Hoffman, who's
Okay,
coming to the
thank you.
podium for
All
his
right.
first presentation. Thank you. Madam Chair, members of the board, Dr. Nichols, thank you. What I am going to do tonight is kind of give you an update on where we are with school calendar. We have not finalized it, but we want to let you know what the process is and kind of where we are with it right now. After we've done that, you'll have the opportunity to go through that, review it, offer recommendations, and we'll go from there. So what we have is we formed a committee this year, and we made it a rather robust committee. We had equal representation from all 4 levels. We had an administrator from each school. We had a teacher from each school, 1 paraprofessional from each school, 1 parent from each school. We even brought in a high school student to sit on the committee, and we had numerous central office staff to include transportation and child nutrition services. In total, about 25 people. It was important to do that because when creating a calendar and looking at a calendar, each of those levels has different priorities and different things that are important. And we thought it was important to have equality from each of those building levels. Where we are, initially we had our first calendar team meeting on December 14th. We came together, we talked about priorities, we broke up into small groups, and at the end, we kind of had an idea of where we wanted to go. We went out and we sort of put those things into play. We came back, we met again last week as a committee, and we sort of previewed what we had come up with as the calendar. We are in the process of trying to review that calendar with the leadership team from each school. At this time, we've already met with the high school and Kent Elementary. The other 2 schools, we've had to cancel twice due to snow. So we're going to try to get back on the calendar. We don't want to leave out the other buildings, but what we are trying to do is to solicit their input to make sure that they are heard when we develop the calendar. Obviously, tonight we're presenting to you, and then from there, it's the process of getting feedback, possibly making some amendments to that, and then eventually coming up with a final calendar. We gave the committee a goal, which was to collaboratively create this calendar for the next school year and then be able to present that to you. We also wanted to potentially take a look at 2 years down the road, the 23-24 calendar. Considerations, and a lot of these things are things we're doing this year. Currently, we have 7 teacher work days prior to the school year beginning. We looked at a post-Labor Day start. We looked at our requirements in terms of days and hours. We looked at our contracts for teachers being 200 days. We looked at potentially having 3 at-home learning days or asynchronous learning days. We looked at a traditional 3-day Thanksgiving break versus the week-long, which you were so kind enough to grant us this year. We looked at the 2-week winter break, the 1-week spring break, potentially having a holiday on the Monday after Easter, and finally getting that last day of school in there by June 16th. Real quickly, some of the other local school divisions, this could change, but when we went to press with this is what their plans were and when they were starting. A lot of this is early starts prior to Labor Day, and there are some reasons for that, and there are some obstacles that we run into when we consider a pre-Labor Day start, and some of that really revolves around the schedule that we had at the high school. So what we are going to do, we will have a post-Labor Day start for next school year, and we will do the same thing for the following year. So another challenge that you'll hear about in a future report is Quinton Elementary School, making sure that is done and we're moved in and all those pieces. So not that Kyle and Tim aren't on it, but it just, we need every day and every week we can. So that was another factor for next year.
And those 2 weeks are critical, particularly with supply and chain. And right now we're having some issues getting stuff, and we're going to surely make our day with those 2 weeks. What I'll do now is I will kind of show you this year on month by month versus what we have proposed for next year. What you'll see a change here in the pre-week. We typically have teachers back for 7 days prior to students arriving. We have changed that to 8 days for this upcoming school year. The reason we did that, we ended up with a 179-day calendar for next year. Typically, we're at 180, so that the contract was accurate. We needed to find an additional day for teachers, and we found that adding it in a pre-service week was a good idea. It was looked upon very, very fondly by our school administrators. So what we will be doing is, instead of a 7-day pre-week, we are going with an 8-day. September was very similar. We're starting on that Tuesday after Labor Day, so there's nothing else that's different in September. In October, we kept 1 at-home learning day, And what you will notice, currently we have 4 for this school year at-home learning days. We have done a lot of reaching out to the community and to the schools. And our plan for next year is we're going to recommend that we go with 2 at-home learning days versus 4. Some of the feedback we got has been positive. Some of it has been less than positive. The less than positive is really centered around what's going on at elementary school. And we have talked with administrators. Ross has had a hand in that as well. We think we will have a much better plan, a much more comprehensive plan for the at-home learning days for elementary. So, but what our recommendation will be is we're going to have 2 at-home learning days next year, 1 in October, and then as we get to it, you'll see there's 1 in March. In November, you will see if you go down to the red days, with the committee really enjoyed having a whole week of Thanksgiving, which is not shocking. And what also happens when you add vacation days and holidays in there, you have to take from other places. So what you will see here is the only other change in November, we had an at-home learning day this year, the day before election day. We have taken that away. That's one of the at-home learning days that we took away. So we're going with 1 week at Thanksgiving, and we still have a teacher work day, which would be on election day. December, identical. We have 2 full weeks for winter break. Into January, and we'll have to toggle back and forth a little bit. We still have Martin Luther King Jr. Day, 17th this year, 16th next year. What is a little bit different is going to be how we end the semester. Currently this year, when we come to the end of the first semester, the 28th is a half day. And the 31st is a teacher work day. If we go to February, because the semester ends a little later next year, what will end up happening? The 1st and the 2nd will be early release days for the high school, but it will not be an early release or half day for elementary. And that was some of the feedback we got from the committee, which included parents. There was no real reason for us to do that. The reason it needs to happen at the secondary level is, as you know, because we're on a 4x4, that's ending the school year for that class. So there's a complete restart. And what that requires is time to accumulate grades, to run F lists and determine which kids are going to have to change classes at the semester. So they need those 2 half days in that work day so that when we restart the second semester, we're ready to go. So that's why we're going to keep the half days on the 1st and 2nd and the teacher work day on the 3rd. And that's why we're not giving it to the elementary school, because they're not doing a restart. They don't need that time right then. The rest of the month is about the same. We still will have President's Day off. As we move into March, as I told you earlier, we will have our 2nd of 2 at-home learning days. April, we have a full week for spring break. And then what you also notice on the 18th last year, we had an at-home learning day. We have taken that away. So that will leave us with 2 at-home learning days versus 4. Moving into May, another change. This year, we have the Friday and the Monday after Memorial Day. Next year, it is currently only going to be the Monday, the Memorial Day holiday. A lot of school divisions do not grant the Friday in the calendar, but what they will do is if you don't use a lot of your snow days, then the board can go ahead and say, we'll take that Friday off. We can take a look at the weather last year. I'm predicting no snow next year, Dr. Nichols. So I don't have to make any more phone calls. And so if that is something where we have hours left in days, that's something we could grant, but that is one of the concessions we've had to do with going with a week for Thanksgiving. And then finally in June, this year, the 17th, the last day of school was a half day, and the teachers came in on the 20th. It'll be a little different for next year, what we're recommending, and it's not green on here, but the 16th will be a half day for everybody, including elementary. And then the 15th will be an early release day only for secondary. The elementary folks do need time to get the year ended, to get ready for that summer and for the next year's start. So they will have that half day on the 16th. You'll notice it's not green on this. That is some of the feedback that we received when we presented the calendar to the elementary staff at New Kent Elementary. So we are listening, and when we can make things happen that are good for everybody and it makes sense, we went ahead and did that. So the 16th would be a half day for everybody in the division. And that will basically what we will do here. We're going to get feedback, as I discussed earlier. both from you, from the community, from the other two schools we haven't met with yet. And then we're also going to offer the public an opportunity to view the calendar and offer their feedback. That feedback will be shared with our committee. The committee will meet one more time at least. And then from there, we'll try to finalize the calendar and make sure that that is ready and what you want as a board. Now, we'll take questions.
Why don't we start before Labor Day? What's the issue with this?
So what would happen is we have to have, because we're 4x4, we have to have the same number of days for the first semester and the second semester.
Will you dive into 4x4 just so everybody understands what a 4x4 is?
Essentially, our students go to 4 classes a day, every day. So they're taking 4 classes at a time. Then they'll do the same thing in the second semester. So the 8 classes for the year. When many of us went to school, and not that all of you were as old as me, but we had a 7-bell schedule and we went to all 7 of those classes for the whole year. We would have to start the first week of August to have equal length in the semesters. It just wouldn't. Yeah, like August, I think it was like August 6th or something.
So what happens if we do a pre-Labor Day start in a 4x4? What you essentially do, the goal would be to do something similar to colleges where you end before winter break and then you restart. Because of the 4x4 and the number of hours by code we have to have, we can't fit that in by December. So if we go, let's say we go a week before Labor Day, that's fine. But now you're shortening the time. Kids are going to go away for the break and then they'll take exams the week after they get back. Or if it's, so we get into this, the more we pull it back, the closer we're pushing to exams to the end of the break, which puts our kids at a disadvantage. So we're looking at several things. Either we need to overhaul the schedule, because if you're going a straight 7 or you're doing a different version of scheduling, you're not bound by a certain number of hours by December. We could have a shorter first semester and a longer second semester, which would allow us to end it where we wanted to end it. So it's a little convoluted, but that's really, to go before Labor Day doesn't yield us a whole lot right now. Until we work on some of the scheduling things. And that's, I'm not saying publicly we're changing the high school schedule, please. Don't get that one out there. But we're just looking at those options. The nice part about a 4x4 is you get 8 classes a year. So that's why we have kids that are graduating with an associate's. And that's why we have kids that are having these bridging communities opportunities. And because in the high school, you have 32 opportunities. If you go 7, you're 28. So you've eliminated 4 opportunities for kids. So it's just, there's a push and a pull with everything we do. So that's why the pre-Labor Day is still, we're still looking at it, but not as quick to jump at it on it as some other folks.
Just a quick question on this. Is it state mandated that, who determines, like, why is 180 the magic number or 990 hours?
I believe it's code.
That's state code.
I mean, it's state code. That's what I'm saying.
It's state
So it's
code.
not like a federal issue. It's just more of a, every state has their own code or lack thereof of how many days they require for everyone to go. Okay, I just wanted to clarify because it just, the other question I had with the, you brought up an interesting point about the snow days. And I know the goal is to try to end by June the 16th. Do we have the option in next year, 2023, because we'll probably burn up all of them this year, but if we have additional snow days that are left, can we subtract those from the end of the year? Do we have the option to do that?
Yes, the board definitely has the flexibility to do that. That's essentially what you did for Thanksgiving to make that work
Okay.
this year. And I will tell you at the rate we're using them now, we still have about 6.5 days cushion in minutes right now. But we're looking at,
It's gonna be a later snow this Friday.
okay, so we may be clear on Friday.
Weekend.
But I mean, we're just, I mean, some Januaries are just like that, but
Yeah.
absolutely, we would have the
Okay.
flexibility to do the Memorial Day Friday if that was something we wanted to work on, or end the school year earlier. So
Okay.
you definitely, as long as you hit 990 hours, that's what code says. Or 180. So we're just very fortunate, and our kids may not think we're very fortunate. We have a longer day, which just gives us greater flexibility.
Okay, thank you.
Mr. Hockman, can you talk to some of the advantages of starting before Labor Day? It's a long season to start a fall sport. You're starting in early August and games Can you talk a little bit about some of the advantages of starting early?
Some of the advantages, and it depends on your perspective. Some people would rather be off at Memorial Day and end the school year at Memorial Day. It's sort of a natural break. There are other folks that want their full August. So it's kind of like one of these things. If we end early, we have to start at a different time. Athletically, it's coaches would tell you it's an advantage sometimes. Sometimes they'll say it's a disadvantage. It really depends on the sport that you coach. From a parent perspective, we heard a lot in all of our communities that, hey, I've already rented my beach house 2 years down the road. And I'm not going to give up that week. I put my down payment down. The truth of it is the benefit is as a school and instructionally for us is if we could end prior to winter break, that makes a great natural time to end that first semester. If we can't, then in my mind, instructionally, it doesn't make a lot of sense and it doesn't help the kids as much. For me, ending early is not great unless we're doing something that really does benefit the kids versus potentially me being off in June or August.
So another consideration is we're part of 4 regional programs, Bridging Communities, Code RBA, Chesapeake Bay, and Maggie Walker. Right now, they're on 3 different start times. So Chesapeake Bay has always been pre-Labor Day. They start on the college system, and we run transportation there, so we navigate that. This year, Bridging Communities went 2 weeks early, and we navigate that. I will tell you on the pre-Labor Day side in the line of regional programs, it is beneficial because of Bridging Community. My son is in Bridging, so the first 2 weeks is 2 weeks before school started, he started with 2 classes. I mean, with half a day. And then at the end of the year, we'll go for 2 more weeks and he won't have to come because he doesn't have bridging until whatever that time is. Same with Chesapeake Bay. Next year, Code RBA and Maggie Walker, our kids are there full time, but we still provide transportation. They're both planning a pre-Labor Day start. I think they're looking at a week or 2. I can't remember. But on the regional side of things, that would be a benefit of going pre-Labor Day. 2 weeks is to line up with our regional programs.
Board members, any other questions, comments on the calendar? Okay, thank you
Thank you.
very much. Okay, the next item on the agenda is item 3B, the award of security grant and request matching funds. Ms. Haney Moorheim. Good
Madam
evening.
Chair, school board members, Dr. Nichols. Late December, BDOE announced $12 million in state school security equipment grants. 583 schools and 93 school divisions were approved. We were one of them. So we're asking tonight that you appropriate $110,764 and $27,691. Excuse me, matching funds. These will be used at our high school for security cameras, 2-way talk radios on the buses, and exterior walls of the school buildings. If anyone has any questions?
Yep. I'm sorry, go ahead.
So for the security cameras, will we be replacing outdated cameras or will we be expanding our coverage?
Yes, ma'am, I'm gonna call on Mr. Pollitt.
We will be replacing the original system that we are first going to get most of that out. We do have some newer cameras that we put in on Vision on the outside. And we can update everything.
Great, thank you.
We can all on one system.
Yeah, I think one of the requests I had mentioned to Dr. Nichols is in terms of the expansion of exterior cameras to go to the football field where the concession stand is and where that issue is over there, just because of the density of traffic over there. And every year, it seems like that's where the most students huddle and we potentially have the most challenges at different times. And even it could expand to like the gates where they're coming in just. Yeah. And, so that's one of the things, I guess, that we can look at as well, if we can extend the cameras to that degree, because now in the age of exterior things, especially with students, it would behoove us to make sure that they know that Big Brother's watching them, on these extracurricular activities.
And sometime on this particular grant, we ask for it every year. There are some guidelines with annexes in certain areas that you cannot apply for. But we could certainly look into see if that was an area that was applicable, or we could look into just moving forward with that separate CIP.
Sure.
Funded item.
Yeah, and so in talking to the high school about, it, they actually had an additional request, the outside patio is another area where, especially now, we have kids out there quite a bit. So looking at some of those exterior spaces, we'd likely come back with a additional CIP request for it.
Thank you.
Okay, thank you. And board members, this will come back on the agenda as an action item for vote. Thank you, Ms. Moorheim. Next on the agenda, under old business, number 4, Quinton Elementary School update, Mr. Tim Pollock and Mr. Kyle Moser.
First thing I'm going over is Kyle has been nice enough to make up for this section, so we understand the progress a little better. So what I'd like to do is walk up there and actually go through.
Absolutely. Thank you.
All right, this section here in B is basically the only area we have as of right now that's completely closed. We're actually looking at, we do have power. This is where your power comes into the building, the main power. We just put full power to the building, so it's powered up at this point. The gym, we're basically sealed in. The cafeteria area, all the sheetrock's going up in there. The kitchen area, the plumbing and all is going in. So those areas are moving along well. Section C here is the wing coming down through here. It's pretty well, it's coming along well too. Fireproofing's been done, sprinkler systems in, the area through here. The only thing we are missing is still some windows in there. So we're not able to completely close it up, but it's really close in this section to close up. The area we just poured is actually in this area right here. We just poured the roof and the piece for right here for upstairs. So these two upper levels that you see over top of B, this is really still section part of B. And through here on D is the sections we poured all the way up to this point to get where we can get this dried in. This is the key point, because if we don't get this dried in, this is only leaving us areas to work during this time of year, and here and here. Right now, that was our whole goal last week, was to get this poured in the 2 days that we had to do it.
And Tim, what's the main driver behind not being completely sealed
If
in?
you're not dried in, you can't get sheetrock. I can't do the finish.
But why aren't we sealed in?
Steel was one of our main reasons why we weren't in sections there on it, where we were waiting for, basically, we were doing all the masonry work we could and waiting and dropping the steel in as it showed up. Some of the steel, most of the steel did show up for this area and this area here. That allowed us to get the board. And basically, last month was about the worst month I've ever been on a construction job. We just did not have a very good month up there at all to get the stuff done. Between people being sick and out and just the weather itself.
And the roofing membrane is on.
The roofing membrane is mainly over here still. We have a little bit on C up there,
Mhm.
but it's still not completely in.
Okay.
Like I said, as far as the mechanical guys and all that, they're moving. The second we get a second where you can seal it up and get it in, it's going. And what we're looking at doing as of right now, we're about 50 days behind. That's a tough reality. I mean, as of right now, we're 50 days behind. What we're looking at doing to change the progress on this is looking in March. We're not going to wait till April, May, and all that to do this. We're looking at March, about the middle of March. As soon as I can get some more areas, when get some more areas dried in, that we're going to put 2 crews and 2 shifts in to be able to try to make up for it so we don't have to stand on top of each other while we're trying to do it. But the key point again is to get the heat and just under control temperature wise in these buildings in them sections. Anybody have anything they want to ask?
So you say 2 shifts, so it would be like a 24-hour operation there for how long?
2, 8, 16 hours,
16?
2 shifts.
Yeah, some of our neighbors would be a little disappointed if we went.
That was,
past.
that's where I was going with that.
But it'll be on.
We get those calls already, but
It's on
no,
the
we'll be
inside, that it won't
maximizing.
be as noisy, right?
It's gonna,
Yes.
the outside, we're
It will not be as noisy. No.
We're planning on pulling the construction trailer out there soon, cars, the outside of the building and all. We'll be okay on that part of what we gotta do. We've gotta get everything sealed up. We've come to that point.
Being 50 days behind, that puts us into August.
Yeah,
What's
we'll
it,
say it
beyond
that, we'll
August?
say it that. Okay, we were doing a lot better before, and our substantial completion date we were looking at was May. So for substantial completion, our contract is July 11th.
That was going to be our big surprise to you was a May delivery, but
Yeah.
The contractor is to us on by July 11th. You know, as of right now, we're gonna go week by week, basically, we're gonna be up there, we have a lot more, we gotta figure out how we're gonna get from point A to point B. And we're in the west part of the year, all of it, it's like where we started.
So has the contractor asked for extension days? Okay.
Now, we're not, and we're, as of right now, or, you know, you've got a bad weather or anything like that, you see what's in there. it's actually-
Yeah, that's what I saw. Yep.
Gives you a good layout on that. Right now, which is, everybody else, we're struggling on a little material here and there. It's making the job move a lot slower than we like.
and Tim mentioned it, but just to expand on a little bit, COVID has impacted us on the job site quite a bit as well, just with workers and crews and, you know, It-
We had like a nice blast today. Not doing it.
Yeah.
Okay, any other questions for Mr. Pollock before we move on to Mr. Moser?
I may think of another one while Mr. Moser talks, but we're
All
good.
right. Thank you, Tim.
Thank you very
Appreciate it.
much. Appreciate it.
Similar to previous presentations, we get some visuals of what we was talking about. I did want to start here though. When I was digging through the archives, I came across this. This is what the site looked like last January. Wow, seems like ages ago, but this was mid-January 2021. And if you look at it just last week.
Wow.
So you can see it's really a tale of 2 sides of the building. The side of the building that is adjacent to 249. That's where they're getting closed in. And then on the north side of the building where South Quaker is located, you can see that's where they're actually pouring that top deck. That was the policy system for. So, like I said, the weather, COVID has been a perfect storm for the last month for us out on the job site. So if you look at the first image, I'm gonna start on the back of the building where the finishes are taking place, and then move us to the front. Just so you can see the updated progress. So again, most people see this from the road when they're going by, the back of the building, the cafeteria, the bus loops. If you look close enough at that American flag, you see masonry behind it. So the masons, I feel, look at record days. They're always out there working, rain, snow, sunshine. Look a little bit closer at some of the finishes. This is where we get really excited. So you can see the masonry work off to the right. You can also see the windows being installed. And then along the bottom, you can see some use of some classrooms. So the lower left-hand side is a second grade classroom. And then on the lower right in the middle, that's a third grade classroom. This is the cafeteria. This is one of, I think, one of my favorite parts of the building. Again, you can see the windows going in, some primer going up. Also, you can see the ductwork and some drywall also going in. You get to visualize where our students will be on a daily basis. It's a great space. What you can see there is the stage that's in the middle. Presentation, guest speakers, the perfect spot for adults. Our next spot is the gymnasium. We get the PreLabor work back. This is one of the first pieces I received. There's our cup. So this is sketch one of our cup that will be on the floor of the gymnasium. And if you look at the image from last week, you can see they've done an extensive amount of cleaning in there. Also dump work, and related infrastructure work that we need in that space. Our next space too that we'll highlight is just the entrance of the building. This will be another space that we have designed. Being on to our mascot help. That'll be the garage with inlay. And if you look at the picture in the upper right-hand corner, that's where we'll be located. So it's definitely pieces of school pride there. Again, this is our first sketch coming back to school finish in the near future. After we move to the front, this is the part I think most people don't see, all South Quaker. So you can see that we're getting there slowly. This is where a lot of the steel is missing. So that steel we need to pour concrete that just showed up on the job site. Hopefully will be installed in the project. As you can see, that it's pretty muddy right now. All the minerals out there, they almost got stuck. There's the plain principle. Here's a look at our main office in the upper left-hand corner. Again, we've got a lot of work to do in there. And then the two other pictures are of our kindergarten, first grade, and preschool wing. So those learning spaces are really beginning to take shape at this point. Put a place down highlight really quickly. This is the second floor landing. This is where our steam lab will be. This will also be an area at the upper left that will overlook our library. This will be a great space for classes to come together, projects, to experiments, and really tinker with technology. And the very last piece I want to highlight, of course, I think it's most of our favorites, is the rooftop terrace. This is a place where students can go out during the day. There's going to be some planners up there that I can see going very nicely with all of our science standards. So I'm looking forward to classes going out there with gardening and flying across the curriculum during the days after elementary school. So the last piece I want to highlight here just very quickly is kind of some of the non-construction work that I've been doing the last month. A lot of this work is being geared towards the staffing of the elementary school. Like I said before, we're shifting population, therefore our staffing will also have to shift. This has been an all hands on deck type of project. Every person here from the county has been involved in some way. So our goal, and we're still on our timeline to do this, by February 1, all of our elementary staff will know where they're going to be next year. That will give them time, give us time to get our staff together. I'm super excited about this date because I finally get a staff February 1st. Planning principal can sometimes be a lonely word, so I'm finally get my team in February. The staffing of the three schools were based on some pillars. You can see some of them right there. For example, enrollment, of course, is a big one. Where all of our students are going to be. This has been really tricky because we constantly have students enrolling. I remember coming to the table the first week of January, and Dr. Stan and Mr. Dart said, oh yeah, we have about 50 new students enrolled. So hopefully 50 new students will keep enrolling in 2 weeks. That could be really true. Some other things that have really led to our staffing decisions, programming at the schools, staff surveys. If you look at the chart to the right, that is our survey work, where teachers wanted to put their interests. You can see their first choice, second choice, and third choice. From a quiz perspective, more people wanted to come to quizzes than I need. So I need about 40 to 50 staff members. We have over that obviously demonstrate interest. To give you an example of what it kind of looks like, just look at K through 5. We'll need 21 teachers at Quinn Elementary School. When you look at enrollments, that basically meant 6 teachers had to come from Newton Elementary. 14 teachers really had to come from George Watkins, and then there was a +1 to Quinn College. So that's been a lot of work. We're meeting again tomorrow morning to keep this going. All right, we may be losing time in some places, but we're staying on track and others. Number 2 up there, which is also huge, and you can see in the lower right-hand corner, we're starting to get in our instructional technology. So we talk about supply chain, we talk about prices and inflation. We are already receiving the tools we need to instruct our students. So just today, we had 40 screens show up. Last week, we had some projectors show up. So the beauty is, when we do get to go ahead and go in this building, we'll have all the tools we need to teach. And then the very last piece, and this is something we also worked on today, is we're now going to have 3 elementary schools. So we're working hard to come together and really solidify our instructional plans. So I really enjoyed working with Ms. Gum, our elementary director, Mr. Jarrett, Dr. Stan, and bringing our three elementary schools together so that the education at Hooper Elementary looks like the education at George Washington. So that's where we're at right now. When I come back next month, we'll have more good news. But again, just because we're falling behind in one place in this project doesn't mean we're falling behind in other places.
Thank you. Board members, any questions for Mr. Moser? At this time?
When you said you started getting equipment in, where are we storing that? Is that being stored on site?
It is on site. I don't know if that's.
Security.
No, I mean, but my point is that it's coming in and.
Yeah, it's not at the Quinton site. We have it as secure location.
Right,
Yeah.
that's what I wanted to make sure.
Yeah.
of.
Good answer,
I just
Kyle.
wanted to- Yes.
Yes.
I mean, just simply because, obviously you have a lot, the division has a lot of money invested in that, and that's when you're sitting on it for 6 months, that's a long time to be sitting on equipment, so.
We're trying to organize it so.
Yeah.
I showed that picture of the room. It's okay. This is the account
Gotcha.
for the cafeteria. That way, when it comes to July, August.
Gotcha.
Moving houses.
And we're working on the logistics of moving teachers because teachers are going to have to come out of their regular school by June. And they can't move into Quinton until late August. So if you've met teachers, we have a lot of stuff. So we're just trying to organize, where that goes and how that goes too. So lots of logistics around it.
Okay, thank you. We'll see you next month. Thank you. Next item on the agenda, 4B, health update, Dr. Nichols.
Yes, thank you, Ms. Swinford. At our last meeting, we agreed that I would bring to you a health update at each work session. So this is that health update. And we met 2 weeks ago, but it almost seems like a different world ago. A lot has happened in 2 weeks. Some of it we were anticipating it, some not at all. And we're just managing it and kind of working through it. So I'll take you through. Feel free to stop me at any point in time. I think the most talked about is an update on masks. So I'm going to start there and then I'll get into some metrics for you. So this is an update on guidance and rules. And this slide looks different from the last time I brought it to you. So number one, the former health order that we were under that required masks was rescinded. Number two, Governor Youngkin issued executive order number 2. And I just gave you one quote out of that, and I won't read that. The sort of the difficulty or the thing that's got the most attention is Virginia. This law is still in place. 1303 remains in place. And VDH's guidance for COVID-19 was updated. So basically the former guidance was rescinded. Executive order was to be implemented by today. We actually didn't get VDH's new guidance until late Friday. So we kind of flew blind all week, and to our families and our communities, I want to apologize for communication on a Friday. It was not my intent to be tardy in the communication. It was really my intent to try to get additional guidance that was promised to us, because I didn't want to go out. What we prided ourselves on is not going out and saying something and having to pull it back. But that guidance was just not available and we had to move forward. So we did that and kind of move forward to today. So that's a little bit of the update on guidance and rules. Speaking of the new guidance from the Virginia Department of Health and the Virginia Department of Education. So they co-authored this new guidance. Some of it looks very familiar to us and other parts of it look very different. And we had a meeting with the state superintendent and the acting commissioner of VDH today. Did not get a whole lot of clarity, but got promises to get answers to questions. So really what they did in the guidance is they broke it down into 3 parts, and implementing prevention strategies to reduce the risk of COVID, share responsibility between parents, families, school officials, and local public health authorities. But they went on to define who does what when. So this is publicly available. So parents, they have keeping children home when sick. And if anybody hears anything in this entire presentation, please keep your children home when they're sick. The biggest challenge we face in this right now, children and grown people coming to work when they're sick. It is the biggest challenge that we face. And I know people want to be here. I want to be here every day, but you got to stay home when you're sick. Vaccinations, which you've talked about quite a bit, and then masks. So VDH and VDOE are going to line up with the governor's office. They're part of the governor's umbrella. So this was an attempt to make all of that line up. Under the school side of things, I won't go into all of these. The first one was about ventilation. Mr. Pollock and his crew are constantly replacing HVAC systems. I think we did 3 over the winter break and continue to do that work. Physical distancing, which in New Kent is a challenge when you have 15 kids enrolling each week. Making decisions about excluding children, and I'm going to dive into that a little bit more with you guys. Offer COVID-19 testing programs, which we continue to work on. Our cleaning, and really notify families of cases. So while I was here, the high school notified families, because I am a high school family, of positive case today. So continuing to do that work. And then notify public health of outbreaks in a timely manner. One of the biggest shifts in this new guidance is now the role of our health department, which I did not include that piece in there, but so we were going from reporting individual cases to, sorry, Ross, individual cases to the health department to no longer having to do individual cases and focusing on outbreaks instead. So it's a shift in that guidance. And to be honest, today's the first work day. We've had to work through it, and we'll continue working with the health department to figure that out. It's a pretty big shift for us in working with them. There's a fairly complicated spreadsheet we fill out daily, which would be nice if we didn't anymore. So that's a little bit about the updated piece. I want to come back to New Kent's health data. And I share this, and we'll continue to share this at each work session. So what you have in front of you is a pull straight from VDH about New Kent. And it has those 4 categories that we've grown to know. And I'm looking for my notes to tell you what they were the last time we were together. So number of new cases reported, 48, 7-day average is 46. When you aggregate that to be per 100,000, its 7-day average is 204. And total number of cases, 2,939. So the last time we were together, which was 2 weeks ago, those numbers respectively were 36 in the first column, 35 in the second column, 155.7, and then 1,773. So we're still surging in this category for New Kent County, and we certainly see that in our schools as well. So with all these shifts is the timing of the pandemic, which can be incredibly problematic for schools and implementation. But we are working through that. I will say, and I'll say this several times in this presentation, we could not do this work without the incredible staff that we have. Everybody is all hands on deck, doing multiple roles daily, and it doesn't matter what the title is on your name badge. If there's a hole, you fill it. And it's just remarkable. It's one of the proudest things I am proudest of our team and our staff. And when I say that, that goes from the first person that reports at 5 o'clock in the morning to the last person that leaves at midnight. And it's just been nothing short of remarkable. So there's a lot of divisiveness and things going on, but I will tell you, our team is incredible. And I'm just so proud of them. So no matter what comes our way, we make it happen. You'll see that in some additional data. Some good news from the VDH, but I think it's an estimate. They feel we're about 7 to 10 days away from the peak, according to our health department. So and I sure hope so, and I hope New Kent is ahead of that curve, and I certainly feel it on the staff side. We talk a lot about if we had to shift to virtual, the same slide you saw last time. I just feel like it's important to reiterate that. We make every effort every day to be in person. And I know there was some speculation about the high school last Tuesday and whether they would be open or not. And Facebook's a wonderful place where people tell you all kinds of things. Was not true, but it's close a lot of times. So I'm not going to say that every day we're ready to roll. Every morning we're kind of filling gaps and making sure that we're ready. The snow on Friday was an incredible blessing because we were looking very thin in a couple places. It's just the way it is. And you'll see that here in a slide, but so I'm sorry, Ross, I need to jump on this a little bit. So level 1 is always a student or staff member, isolation, quarantine. Level 2 is a whole classroom of students. We do that at the elementary school. We don't do that at middle school and high school. The kids aren't in the same classes. Level 3 would be a specific school moves to virtual. We have not done that yet. So, and we want to hold on that too. While we've seen localities around us and around the Commonwealth and around the nation doing that, we've been very fortunate to this point, once again, due to the hard work of the team. Level 4 would be all schools moved virtual. I think Colonial Heights did that just recently where the entire school division shifted. It is always for the shortest period of time possible. It is not for 9 weeks. It is not for a semester. It is for the shortest amount of time possible to get students and staff back to the building. So that could be 3 days. It could be 2 days. It just depends. So school-related positive cases and quarantines, I wanted to provide an update for you on that, just so you can kind of see what we're working with. I updated this from the last time we were together. So from August 21 to December 22, we had 82 cases involving staff. And you can see that by month. We started out pretty hot with September, and that was the Delta variant. So that kind of follows that 30, 35, and then we dipped back down, or the country, the nation dipped back down. So down to 9 and 8. Oh, the glory days of only 8 staff members in December. But you can see with the new variant where we are, the first 3 weeks, we have 105 staff members. So we have more staff members in the first 3 weeks that we worked through quarantines and positive cases than we did the whole entire August to December. Yes, Ms. Winford.
December 2021, correct?
I'm sorry, Ms. Winford, you are correct.
That's all right. That's all
December
right.
2021.
Okay.
Yes. Oh, wouldn't that be nice?
Have to get ahead of. Okay.
So, and I'd like to tell you that this does not include Monday. I think Ms. Anderson and I will tell you that Sundays and Mondays are our least favorite days because that's where we tend to see the biggest. I believe we had another 10 today from the weekend added to this. So this is just the first 3 weeks. 105 staff members in 3 weeks is incredibly challenging when they overlap with quarantines, and depending on the type and the situation, it can last longer than 5 days. Last a lot longer than 5 days. But so just so you can see it by month and just kind of see what we're working through with the staff piece. Vaccine updates, I provide this for you every time as well. I was trying to get it by school, but that is not readily available. You can make some assumptions in this data. So 12 to 15 is most of your middle school population. Fortunately, we only have one middle school. And then the high school, you can see the 16 and 17 is at 64.1%, and the 5 to 11 generally your elementary schools, but not broken out by Watkins and New Kent Elementary. Each of those numbers is up between 1 and 3 percentage points from the last time I shared it with you 2 weeks ago.
Would these numbers include students that are not part of New Kent public schools?
Correct. These are just students that live in New Kent, that locality. So we don't track that as a school division. We don't have a tracker associated with that. So we rely on the VDH for those numbers. Changing CDC guidance. Yes, it does change quite often. So we've received additional CDC guidance or quarantine guidance. School districts can choose more stringent isolation and quarantine. Here's where we are right now, and we're kind of working through that. Adults are following the new CDC guidance. This is the same slide you saw last time, which allows staff to return after 5 days of isolation instead of 10 if they meet the established criteria. And we have a number of staff members coming back on day 6. Students right now are either following the 10-day isolation. There is a 14-day option, and we do have some families that choose that, but we have it at 10 or in either the 10 or 7-day quarantine guidelines if they meet that established criteria. So you can test negative and come back earlier than the 10 days. So that's where we're at now. The new guidance states that you can come back after day 5, student, staff, but you're required to wear a mask for 6 through 10. for days 6 through 10. That is what our staff does. When you go mask optional and then you have a mask requirement 6 through 10, it gets really tricky for schools to figure out and work through with families, because you have a mask optional piece, but then you have a mask mandatory for specific students.
Well, even when you don't have that, you still have lunch and things like that where the kids are taking it off, sitting next to each
That's
other.
a great point, Ms. Dasco. There are 3 occasions in elementary where the mask, even mask mandatory, does come off, and that's lunch, that's recess, and that is PE. So there are 3 times that you have. So it is very complicated to make that happen. It's made more complicated by the current environment that we're in. Yes, good point. What we're really struggling with right now is contact tracing. It is, last week, we had nearly 500 students in quarantine and 66 students tested positive. Now, I don't have to tell you how many phone calls have to be made when you have 500 kids in a week that are related to quarantine. The health department does not assist us with contact tracing. This is really squarely on the shoulders of our school nurses and clinic aides, who were actually hired to do a job that is not this. They have a full-time job being a school nurse and have become full-time contact tracers. So it's a heavy burden, and it's as much time as they invest in it, I don't know that we're not contact tracers. You know, there are times when you have 500 kids, there are times you're not getting notified for a couple of days related to it. And that can be frustrating for families. It can be troubling on the school side of things. So it gets very difficult. There are several schools divisions in Virginia that have discontinued contact tracing because it's no longer practicable, to use that language. Instead, they've shifted to a model where symptomatic students stay home, test, and return when well. Students who have been exposed monitor symptoms, so you still work in partnership with the family, but continue to attend school. Virginia Beach started that in December. Several other school divisions in Virginia have done that in January in partnership with the health department. This is something we're allowed to consider now. It was not something that we were able to consider in the fall. So it is something that we can consider. So a recommendation for us to consider is to move to a model where symptomatic and positive students stay home. So we would not follow the 5 days, come back day 6 when you're masked. It'd be 10 days of isolation if testing positive, return on day 11. If you have COVID-like symptoms, still 10 days of isolation. You don't have to take a test, return on day 11. If you have COVID-like symptoms and you obtain a negative COVID test, you can return when those symptoms have resolved using the regular school health protocol, which would mean day 7. So I know that's a lot, but so 10 days if you're positive, 10 days if you have COVID-like symptoms, but you can't prove that it's not COVID. And then if ill, you can obtain a negative test and return to school, would be what we're proposing. That our isolation protocols will really focus on positive and symptomatic students. Board members, I know that's a lot in 3 giant bullets. But
One of the questions that came up in this scenario here, how are we treating students who just say, or their parents just say, Johnny just doesn't, or Sally just doesn't feel well today? Then do we require them before they come back to school to still have a negative test? Or do we just say, Johnny feels better in 2 days, and we let him come back to school without any consequences of having to have a negative test to come back?
And it really varies by situation, which is another reason that it's extensive. The time we take is pretty extensive with it. So we've had families specifically that the student's not there today. They are displaying COVID-like symptoms, but they also have allergy, whatever is associated with it. And the parent says, he has allergies, this is allergy season, this is this. And so it's okay. So it's more on that line of things. And then it goes into questions about exposure. Have you been exposed to somebody that's been COVID positive and you have those symptoms? So it really kind of goes down like a question decision tree. So a kid could come back because they just weren't feeling well, or they may have to do the negative test depending on the tracing that connects with it.
Why is it 7 days on the board?
It's the negative test. So,
Okay,
Yeah.
but they're out for 7 days.
correct.
So you get to come back 3 days early, basically with the negative test.
With the negative test. yeah.
Okay.
So one of the things in the VDH guidance that they put out a decision tree for families. And I really wish they hadn't done that because they put the guidance that CDC has, but they're not taking into account all the things that we have to navigate. So we've had to have a conversation with parents about the 5-day return on day 6, but that day 6 is with a mask. And that also means other isolation periods and you can't do, well, I don't want to do that. Well, I know that's why we're not kind of following, those pieces, which we can. It's just difficult or problematic, I should say.
So how are we, regardless, if they're in quarantine just because they're exposed? That's what I'm trying to look for, if they're asymptomatic.
So the exposure piece, we would move to monitoring symptoms.
Okay.
So
I
we
just
would
want
not
to make
move
sure.
to-
Okay.
If they did not have COVID-like symptoms, more than likely they would be with us,
Okay.
would be the proposal.
That's just still that's still a big pill to swallow.
Well, and we're gonna, I'm sorry, say it again, Ms.
I
Moore.
just said it's like I can see how what the average nurse would think would be a 5-minute conversation turns into a 20-minute conversation.
Oh, absolutely.
Because they're trying to explain this in a way that it addresses the issue, but at the same time, you're trying to pick the best case scenario to bring the student back as quickly as possible. And the parent is like, well, but I don't understand that.
Our goal is to minimize the quarantine time as safely as possible to have more kids in school is our goal. But it is different. And all of this requires flow charts that would go with it, but we didn't go into that piece. So I say that we would not quarantine, but there are occasions where we would. So quarantining of known contacts, and this has been developed by our nurses. This is not a recommendation that it is coming from me, but it's really in partnership with them. So let's say both of my boys are here at the high school. If one of them tests positive, the other's going to quarantine. He's a known contact. He's in the same house. Even if he's not having symptoms, he's still going to quarantine more than likely. So, and also it would connect to our sports teams as well. So if we do have a positive case on a wrestling team, for example, we know the nature of wrestling or the nature of basketball or nature of those, chances are it's unmasked, it's close contact for an extended period of time, that we still would unfortunately be shutting some of those programs down for the shortest period of time possible. So those are some of the instances where we would still do that. And you can see the 10 and the 7-day options still prevail. So we're trying to have 10 and 7-day throughout, so it's consistent. Once again, that's kind of a recommendation moving forward that we can shift or work through.
What has been the easiest or the most reasonable, no, the most practical way, I guess, for the staff to navigate through right now?
In terms of,
When they get a call from a parent that says, my child has tested positive and they are in such and such as class. They were there yesterday.
Mhm.
What am I supposed to do? So walk me through that. What would happen?
so what would happen from there is we have seating charts. We would go back to when the child first was symptomatic. And then we would begin the tracing from there, this elementary. So 2nd grade, the seating charts in the room, look and see who was exposed, bus if the kid rode the bus. We go to resource because actually kids do sit around who they sit within the classroom. So that's not as much, but a cafeteria becomes the biggest one. But, things we don't know when we move to the high school level, when we do that, kid is in a bunch of different classes. So now we go to 4 classes and trace. We do the bus piece again. We do athletics. But there are areas that we can't cover. Like tonight, we're playing basketball. We just tipped off 6 minutes ago. We probably have about 100 kids in that gym, sitting next to whoever. And, so there are mechanisms that no matter how many questions we ask, we still don't know who Brian sat to, those pieces, or what you do outside of the school piece. So we kind of work through all those pieces and identify the close contacts there. That's for it. Now, we had 66 of those last week. So that's just, in addition to, we're still doing daily hearing screenings for kids. We're doing vision tests. We're doing, vaccination updates for standard things that they have to have.
And that was happening while everybody was wearing a mask, right?
What's that?
That was happening while everybody was wearing a mask.
Correct. Correct.
Okay.
Yes, ma'am.
Oh.
So it is heavy lifting.
Well, and I guess that's, when you look at then if I hear you correctly, one of the biggest challenges that we have is if we can get to the point where we can minimize the efforts, because it is so complicated for contact tracing, then we could at least put ourselves in a position where the staff can do what they should be doing, basically, if I hear what you're saying. I mean, it seems like that the contact tracing is taking an abundant amount of time away from what they can do. And just like you said, I mean, and I guess this is the piece that I struggle with on the contact tracing, and you just confirmed it. There's 100 people sitting in the gymnasium. The nurses just wasted their time calling 10 people today to figure out where they've been, because you can't guarantee any of that. And so what is the viability is that if I contact trace here in the cafeteria, then tomorrow, does somebody ask Johnny or Sally, did you go to the basketball game tonight? And so that's my hard part to navigate through, is at some point, for the sanity of the staff, we have got to be able to draw the line in the sand and say some of this contact tracing, it is just not even practical. I mean, and I guess that is because I'm just thinking about the staff and how challenging that is and how frustrating it is, especially when you have multiple students, that you don't have anywhere, you don't have any idea where to navigate that through, and I think part of the frustration for many parents is students are suffering the consequences just because of contact tracing, and they're asymptomatic. And I think that's part of the frustration. And again, I don't have a solution for it. I can hear what the parents are saying, because
Well, that's why we're trying to figure out what is our next step to move forward safely. I talked to a high school family, and the young man's been quarantined 4 times now.
That's
He's
one of
just
my
had a- he's
questions.
had a
How
bad-
often
he's had a
are,
bad draw.
what is our
Um,
learning loss with
fortunately,
these students?
What's that?
What is our learning loss with these students?
Well,
He's
I
been
mean,
out for 40 days.
So we talked about we're in a 4x4 schedule, so it moves really fast. And then you miss 10 days. Let's say there are 2 weekends, you miss a week's work. Now our teachers are still connecting with kids, but there's nothing like sitting in front of our teachers. Which is why so it becomes this, what's the greater good on this one, and how can we safely move forward so that kid doesn't miss as much time? Can we partner with the parents?
Well, and this doesn't change anything for the way that we contact trace for teachers, correct?
Correct. It doesn't really impact the teachers, because the teacher side of things, you're out for staff wise, you're out because you're positive, you're out because somebody in your house is positive, or you're out because your child is being quarantined and you can't. So those are the 3 main, there are others, but those are the 3 main ways. I don't see this shifting, or it's not a solution to that number I showed you. That's still going to be a very tough uphill battle.
But, you reference divisions who've gone away with contact tracing and how they handle that situation. I mean, you said Virginia Beach, I know Pocosin. What do they do?
Yeah, Percosin, today is day one for Percosin, so it's a little early for them on that piece. So Virginia Beach started at their high schools and now it's shifted that piece. What they were finding is with their vaccination rates and their quarantines, that the percentage of kids that were eventually testing positive, if they were, it's going to happen in the first couple of days, and the percentage of kids that were 10 days out without testing positive was pretty significant. So could they find a better way to keep kids in school but still keep safe? So that's kind of what they found, and they've been successful with it. So that's probably the biggest example. Everybody else is a little too new to it to kind of draw on that piece. I don't know if I answered that question, Ms. McVie.
Yeah, I just think it's ridiculous. It's, I mean, poor kid who's cited, you know, he's been out 4 times.
And is it still standard is that with the contact tracing, and I go back to the high school based on the statistics that you published, if, not that it really has a long-term effect, but I thought we were still under the guidelines that if a student, and I'll just use high school because that's the most, if 60% of, even though that's not 100% accurate, but for the sake of discussion, 60% of the high school students are vaccinated and they are exposed, they do not have to quarantine, correct?
Correct. That is
Are we
still,
asking that? And I guess that's my question. Do the nurses, is that the first question that one of the nurses
it
asks?
is. It's
Okay.
part of the protocol.
Right.
Yeah, it is. So daily tracking of isolation for positive and symptomatic cases, whether we have to turn that over to the health department or not, we do that. I have spreadsheets that I can see any moment in time and see the student and the staff piece, as do members of our medical team. We're continuing with the biweekly health department meeting. The health department is shifting from cases to outbreaks. That is what they're going to be supporting us well. We've been very fortunate on that side of things. We're moving forward with the availability of on-site testing. That is a slow process. I think anytime you're working with VDH, it's not the fastest process. So we're also trying to put in place the test to stay model. So this could sit right beside the test to stay model, that a kid that did have an exposure could test daily on site by our folks. So we've, and that should be updated. We are actually in the next step with that pilot. So it wasn't, so it was initially the 10 schools. They're a little bit ahead, but they took schools after that, and we're kind of right there with them.
So we could eliminate a great deal of contact tracing if we were a test to stay model and we were on-site testing, correct?
Correct. Yes.
Okay.
Yeah. And which is why we're moving in that direction. To be able to provide that for families. Now, of course, that's in partnership with families. Everything has a parent permission to it. We're not just go testing kids
Correct.
for anything. But it is in conjunction with families. The alternative is your home. And if you wanted to test to return, we would have that. We all know test kits are at a premium. We hope that changes soon, but this would give us increased access to.
So we
testing.
don't have those in hand now, but.
So they are en route. So the VDH delayed shipping by 2 weeks. So, but they are en route. The ones we had before the holidays had expired. They did provide an extension for them of an additional 3 months, but they gave that extension to us when we got back in January. So by that point, we had already given tests out to staff and families to test prior to going to the holidays and those pieces. So we are working on getting additional test kits.
Do you know how many you're expecting? How many test kits?
We typically do about 10% of the population. So I think last time was around 400.
Okay.
It's when I say 10% of the population, it's staff and students combined. Is kind of our starting point, or starting point with PDH. And then I'll continue to provide updates for you at work sessions each month. I do want to mention that today we did Today was day one under the mask optional piece. This is not a statistic that I would say would have validity. This is just my observations being in the schools. Somewhere between 75–80% of our kids continue to wear masks today. Our principals and our staff and everybody did an incredible job of, welcoming students, welcoming families, and then also reinforcing that there be no bullying around the topic. Just to put it as clearly as I can, that whether you did or didn't, we weren't going to tolerate any sort of bullying. And I put that in my letter too, but it was kind of pretty far down in there. But so we're working through it. It does have some staffing challenges in it. I mean, my biggest concern is our staff. And it's not that I'm not concerned about our students, but if I take care of our staff, they take care of our students. So it's really making sure that they're well and they're safe, so that our students can be well and safe. That's, I think, what keeps me up continually is just making sure we have the folks, and keeping folks long-term, taking care of our people today so that they'll be here post-pandemic. But board members, that was a lot, and I'd be happy to answer any questions or discuss any other points.
I'm curious about roughly how many of the staff were continuing to wear masks.
Ms. Barber, I can get that data a little better for you. I don't really have that. I just anecdotally talking to staff, and if a team member has a better data point that I'm saying right now, please approach the podium. Nobody's going to come to the podium. It's a lot of times it was situational. So like I'm doing right now because I am wearing the N95 mask, which we have on site for our staff. We have surgical masks as well for students. So it can be difficult to hear. So when they are distanced, I know a lot of them took this down and did the lecture piece. And then when you work at small group or if you're in the hallway or whatever, it's back similar to what I'm doing tonight, is a method that I heard and saw quite a bit. Some folks are continuing to wear the entire time, and we're supporting our staff. And then if they need something to feel safer and more comfortable, because I guess the idea of 25 second graders coming in my classroom without masks the day after being in mask brings some anxiety, which that didn't happen, but whatever they needed, we're making sure they have. So we have a running list by school, by teacher, and making sure they have. We bought a lot of air purifiers. I think we just ordered more today. So just continuing those best practices that we had pre-pandemic. I mean, not pre-pandemic, early pandemic. Continuing to move that forward. So Ms. Barber, I don't really have a good answer for that. I would say it's higher than the student percentage in the upper 90s. And then it's situational for the most part.
So for parents that want their children to continue to wear masks, how are we assisting them to make sure that their students, when they get off the bus, don't take the mask off?
As best we can. That is a very difficult challenge because we don't necessarily know what Brian Nichols says for Mason Nichols as a real example. My son and I did discuss it. He wanted to continue wearing his mask. I fully supported that, and I'm assuming he did that. I can tell you as a first grader, that mask is all over the place on a good day. That's sort of the because a lot of this happens so fast, those are some of the nuances we're trying to figure out as we go. So that is still in the works.
Right, because a parent choice then becomes a student's choice once the student is out of the parent's sight.
Well, and then everything becomes the school's responsibility to enforce, which is where it becomes difficult. So some of these guidelines sound great, but when it comes to the door and you have 1,100 kids walking through this door and they all come in at the same time, it kind of goes out the window a little bit, and trying to check it and make sure. So that is a very tough one, Ms. Barber.
So how are we handling physical distancing? Because if we're removing masks, and that was part of our scenario with a 3-foot distance layout in a classroom, well, that's gone. So now we don't have that layer of protection.
Correct. If you're not wearing a mask or one person is wearing a mask, the best practice is to go to 6 feet. We're very hard pressed anywhere to have 6 feet distance. We don't have it in our cafeterias. We don't have it in most classrooms. We do have some classrooms where we're able to achieve that, and where we can, we do. But it's, I've been honest throughout that in some places we can't get 3 feet. So, I mean, that is a worry and is problematic.
I just think this is very enlightening. I downloaded VDH Guidance, I think sent it out. During the Omicron outbreak, regions with restrictive mask policies and practices have shown similar rates of transmissions as regions with less restrictive mask policies. Yeah, I'm just, making a comment, and, we look at WHO recommendations, they recommend that they don't even put masks on kids. And look across, in England, you see, they have seal in their schools. I mean, I was watching a soccer game today. We yelled at that stadium full of participants. So, interesting, food for thought.
I think it's also important to note that we're in our current rate of community transmission is at 30%, which is considered pretty high. And our schools typically, according to the VDH, mirror the community. So we would expect to see about that rate of transmission within our community. And during that scenario, it's also recommended to be masking as part of the strategy to mitigate the spread of the disease.
I think it's interesting, Ms. Barber, especially being a rural community, and this was part of our call today, is they're seeing, it's nuanced, but they're seeing less in rural communities than high density populations. So take Fairfax versus New Kent, right? They're seeing less, more intensity in Fairfax. The interesting thing about rural communities is, where do you achieve density? You achieve density every day at school, right? So it's that sort of reverse thinking on that piece. Like, we are the density in New Kent.
Right.
Like, it's hard to find, unless you're at Rosie's, like 1,100 people together every day, plus staff, like 1,300 people. So it's an interesting challenge for rural school divisions when there isn't density outside of where our kids are. We are the density. Yeah.
Especially with the elementary schools having 700, 800 kids in schools that are meant for 5.
So another question I have is, and you shared the data about our staff outages over the course of the year, and we're up over 100 already, and we are not through the month of January. What happens when we remove masks and change that variable? We have an unknown outcome from that.
It is an unknown outcome, and I do want to couch that data. So that was 105. Those are just COVID related. So we do still have other medical reasons and other reasons that folks aren't with us. So that is normal January, which is tough, plus, this other nuance in there. That is,
So how close are we to closing a school? Once we change this variable and we have 10 more teachers out, what is going to happen?
I think we would have to shift to virtual, and we'd have to shift to virtual for whatever period of time to have staff back. I believe I've used this analogy before. Right now, it's kind of like hockey, where a line comes in and a line comes out. So the snow day on Friday gave us an extra day. So we had a lot of folks come back today. But we also had 10 go out. Now, when they balance, if they can balance between our 4 sites and all our different work groups, great. But if it becomes transportation heavy, you may get a call from me and said, hey, we're open today, but we have no transportation. Fortunately, we've been okay in that area, but it's day by day. So I find myself prepared to make that call every day, and kind of have a script and know what it is. And we're just going to change whatever the school name is and give you an estimate on when we would come back up based on staffing. I also want to say, we cover this, but we're covering it on the backs of people that are here. So our teachers are giving up planning, which impacts instruction. Plus, it just it wears you out. I mean, I know teachers today that double blocked coverage just because we were so short. You can only do that so long before you lose that person too. So it's just managing those pieces and wrapping around it. And it's all hands on deck, and people have done a great job with it. But gosh, we've been so close so many times. And schools have shared resources and those pieces. But I mean, it could be any time. And that's really what we've been facing the past 2 weeks specifically. And I don't know the impact of where we are today and kind of what that will bring. I'm hoping we're getting to a peak and we're going to start to come down, but I say all the time, hope isn't a strategy. And right now, that's all I have on that.
Okay, board members, any more questions on the health update? This will come again next meeting, Dr. Nichols, a regular item on the agenda, or?
Yes, this will be just like Return to Learn was
Right,
for
right.
a season, and now we're not doing that. I hope we're doing a health update for a season, and then we're not doing that either. So, but yes, and anything that transpires in between won't wait for a meeting. I'll
Right.
make sure that the board and the public are aware.
Okay, thank you. Moving along on the agenda, last item under old business, the library selection update, Mr. Ross Miller.
Madam Chair, Dr. Nichols, and members of the board, thank you. Back in October, if you remember, I gave you an overview of how our library selection takes place and some things we're working on. So just wanted to get an update on how that is going. As a reminder, our policy manual has in it basically the methodology in policy IA goes over how including libraries. They are selected by the list they generate using a variety of different factors. All of our meeting sessions again have sciences. We also know policy we evolve in there. It does outline what is the process. Each member has a in that with that committee that will review we make the decision.
Sometimes it says the audio is not working.
I'll speak.
There you go.
There we go. That's it. All right. So the once we get a complaint,
That chat feature is helpful sometimes.
you're welcome. So the once the committee, so if we get a complaint form turned in, principal will get the committee, they will meet and make basically a decision as a committee. And then if the complainant still has a concern, then it goes to the division level. And we have a committee at the division level. If there's, and they will make a decision. If there's still a concern, then it will come before you as a school board. So some of the updates that we're working through. So one of the things that I said last time is that we wanted to clearly define this process. And what does it look like at the school level? And so we did put together what that review committee should look like. And so it does include the point about the principal, it includes the media specialist and administrator. It may not be the principal, it may be the assistant principal, but one of the administrators will be a part. Teacher or teachers, a school counselor, one or more parents. The complainant is on the committee as well. And if appropriate, one or more students. This is depending on the nature of the complaint as well as if we have students who have read the book and or material, and or if it's something that we need to get student input from. And so the committee at the middle school is currently working through their first review, and So we got a committee put together and are in that process. So I'm going to go over real quick what that process looks like. So first, they'll examine the resources hired. So in the case of the library book, we make sure that everybody on the committee has access to a copy, and everyone on the committee is expected to read it. And so that we understand the material from beginning to end. So then they, as a committee, will discuss they'll take a look at what are some of the critical reviews of the resource. And so they'll look at different review like AASL and some different organizations. What do the critics say regarding it? As a group, they will determine what's the value of this in our collection or in our classroom, and what are some of the concerns that have come up. What is the concern of the complainant as well? Based on that, they'll form his opinion as a committee as to whether or not it is appropriate for our program. So then they'll discuss it as it applies to the educational program and prepare a report with a suggestion. And that is given back to the principal to then communicate out to the complainant. Another thing we've been working on is once it gets to the division level. So we did establish what that committee looked like. So it would have a member of the division instructional department, someone from our student services department, teachers, media specialists, parents, ad hoc experts. So if the complainant has basically a concern over a specific thing that requires us to bring in someone from the outside. One of the things that came up was if there was a concern over psychological impact on the child, we may ask for basically one of our school psychologists to sit in on that. And they're not a named member, but they'd be an ad hoc member who would join at that point to be able to give some expert input. And then again, if appropriate students. So one of the things we're doing right now is if we have a list of students who have checked out a book, a library book, then we will go back to those students and ask them to give us a written report to come to the committee or something like that. In cases like here at the high school where students have the maturity to take part in committee work, we may have students. And so then the complainant again will be invited to attend a review committee, but at that point, since they served on the previous committee, they now serve on this committee. No one from the school level committee would serve on this committee. So if we have a media specialist, it would be from a different building. Lastly, one of the things we've been working on is media center program guide, which some other divisions have, and we felt it was valuable to take a look at our entire program and put that together. So we've worked through an initial run through of it. The piece that we don't have in there that we want to solidify a little bit more, we have parts of it, but not the full thing, is the instructional program. So what does that look like when a student comes to the media center? So like at the elementary, we actually have classes in the media center as far as the elective or the resource schedule. At the middle school, it's more of classes, teachers signing up to bring their class to the media center and going over specific things. And here at the high school, it's more of them signing up to work with the media specialist on like resource skills. Clarify that so everybody understands what's the one of the things I brought to you last time is consideration that we have actually put in place is at the middle school, we did have volunteers to help us with this. We labeled all young adult novels. That is the most, the young adult section is the most, I'll say, controversial or concerning area. That's been brought up the most. So we did go ahead and label those. And the last 4 admin updates from the middle school principal have told basically on over with parents the process. If you would like to be notified prior to your child checking one of these out, please follow this procedure. And so that has been basically the last one. That's everything I said last time. I'd be bringing back to you. So do you have any questions and have they answered those?
Yeah, the last time Mr. Miller presented, here are all the things we were going to do. And we just want to come back and say, we've done those things and are kind of better prepared moving forward, including the young adult labeling and parent request notification as well. So.
And our The actual, one of the things that we order from, Follett has offered actually, as we order, they will pre-label all the medical for us. So we already have that done for you.
I know we talked at one point, or it was brought up, and just to even go a step further behind the young adults, because I think we had the conversation in a way that would pseudo labeling of, is there a way to label different books at different levels, like G, PG, PG-13? So is the first grader reading or have accessibility to a book that maybe a fourth grader would? And so how are we differentiating between even those levels as well?
So at the elementary level, we actually have it in the library sectioned out. And so and it's more primary than elementary, so K1, 2, and then 3, 4, 5. The library is actually designed in such a way that we can separate those books out and monitor if we go to a section. And
Okay.
so like when K1 and 2 come in, they have a specific direction they go, 3, 4, 5, different direction they go in. Once you get up to the middle school and high school, that's where like the young adult is actually the age section, and really applies to books that are appropriate for students ages 13 to 18. And that's where middle school becomes so complicated. At middle school, you've got students that are from 11 or 10 or 11 years old all the way up to 14.
So, Mr. Miller, this is more of a process update, not a policy update, to be
Correct.
clear.
Correct.
Absolutely. Ross just included the policies in there, just so you know what's on the books concerning selection and review, but really just wanted to update you on our processes. And I just want to thank him and our media specialist for, this is a ton of work that they've been able to turn around in just a couple months with a winter holiday and a Thanksgiving holiday broken in there. So they've really turned this around pretty quickly, and we'll be better as a school division for it.
Yeah, I mean, I agree. Ross, I mean, I can't say enough about what you, how much I appreciate you spearheading this project and taking such an aggressive, stance on making sure that this gets worked through. And I think what this process does, or my hope is, what this process will do is, now that parents have a clear understanding of how the process works, and so that parents could now be actively and aggressively involved in this, whether it is through the library or it is through an instructional issue that they have a concern about, is that now they know how that we have made it. Because I'll be honest with you, having 3 daughters that graduated from the system, right? If you would have asked me when they were in 4th and 5th grade, did I know how it worked? I said, I lost your mind. I don't have any idea how the library system works with each age specific group with books. And so now I think that we're on a track with a process that gives parents enough information for them to be actively involved, to say, hey, I've got a problem with this. I need your help. Well, guess what? We've put things in place for that to happen, and now we can have a conversation about that and moving forward.
Well, I would say that, first of all, just give credit to media specialists. We have amazing media specialists, and they've taken on in front of this. But along with that, my hope is that parents have heard these things and they want to actively be involved.
Correct.
If their students are checking out books, whether it's concerning or not, they want to read the books with their children and be a part of that and understand what their children are reading. And they want to talk to their students about, what do you learn about in class? And let's talk through that. And that's really what we want. We want parents engaged.
Thank you, and I appreciate all your efforts and all the staff.
I do think, as we have heard several public comments about books, the one theme that came through is, parents should have some authority on this, and didn't matter if you agreed with the book or not. I think what Ross and his team have beautifully done with our media specialists is we've created a system where parent does have that choice. They don't necessarily have a choice for somebody else's student, but they have a choice for their student, which I think is a fair compromise, or a fair process to put in place, because you know your child best, that you can kind of partner with. So, I mean, I have two boys. I would make this different decisions for each of them just because they're different in their maturity in those pieces. As a parent, I can go work through that. Ross has two boys. I wouldn't jump in that for him. He knows them way better than I do. So I think this allows that to be in place, which I appreciate them finding, a protocol and a process that we could honor parents.
And we've said this before, and we could never say it enough as a board. This is the way the system is supposed to work in public education. We're not perfect. And so when there are holes or gaps in how we got to this point, it's because a parent had a concern of something that didn't seem right. And so she did her homework and pursued it to get more information. And we provided that information to get to the point where we are today. And it doesn't matter what it is, that's what I believe our responsibility is when something is presented to us is through collaboration and putting all of the folks together is to start plug the holes where we see that we all need improvement in. And I think this is a great example of a process that we can make significant improvements in that go to the educational health and the knowledge to our parents about this is why you need to be involved. Because we can make things happen when parents are involved. When parents are not involved, it's very challenging to make things happen because it becomes out of sight, out of mind. And so I think the blessing in disguise here is that we've embarked on something and started something that can benefit the entire community in a way, an entire school division, because we're able to do what your team just did and help everyone out, and we're better for it. So again, thank you so much for that.
Since we're talking about process, I do have a question because parents have come to me. A lot of times at the middle school, classrooms have their own classroom library. And parents tell me, well, I donated a lot of books to my child's classroom, to their teacher. How does that work in the process when it's a donation? It's not something that's purchased by the librarian. I'll have parents that say, they didn't have enough challenging books. That teacher didn't have enough challenging books, so I donated some. How does that fall into the process?
So that's a trickier one because we don't have an inventory of all of those books if they're donated. And so one of the things that we have been having discussions about are the classroom libraries and how do we take a look at those collections and make sure that not only are they appropriate, but also are they up to date? Because in the library, it's very quick. I can quickly push a button and I can tell you what's my average age of every book and to make sure that we have an age that's more recent and that we're not all just looking at books from many years ago, but we have things that students are going to be interested in from today as well. And we don't have all of those catalogs in the libraries or in the classroom libraries. So we know that we need to go back and get that catalog so that we can keep an eye on what is that turnover on those books and how can we make sure that they're up to date.
One of the initiatives that we have through these ESSER funds, looking at instructional loss or learning loss, is the addition of division classroom libraries. So the catalog process that Mr. Miller's talking about allows us to purchase school division classroom library sets, which are incredibly expensive, but using these grant funds gives us a great opportunity to kind of make it more systematic. But we do appreciate the donations and the support. I mean, it is partnership, but it does create just an additional challenge.
Yeah, and going through Moser, who's going through the selection of a school library right now, and looking at what that's like, the cost is exorbitant. And so when you look at trying to do that every classroom and make sure we have things right at the fingertips of students, it becomes expensive. So those donations are we're thankful for it.
Okay. Any other questions? Thank you, Mr. Miller. Appreciate it. Appreciate your time and the work of your team. Okay, board members, moving along, we are finally to action items. The first item on We can if you want to, if we have comment. Yeah, I know. How about we go through and approve the two action items that we have? We'll get those done and then we can make board member comments. Yes, thank you. The first item under action items is consider approval of personnel matters. Board members, do I hear a motion to approve the superintendent's recommendation regarding personnel matters as presented?
I move we approve the personnel matters as presented by the superintendent.
Okay, thank you, Ms. Barber. Do I hear a second?
Second.
Thank you, Mr. Mead. Any discussion, board members? Okay, with no discussion, a vote, please. All in favor, say aye.
Aye.
All opposed? Okay, the motion carries. Action item 5B, consider approval of security grant and transfer of CIP funds.
Make a motion that we approve the security granted transfer of CIP funds as presented by Ms. Moreheim.
Okay, thank you, Mr. Mead. Do I hear a second? Second. Thank you, Ms. McBee. Board members, any discussion? Hearing no discussion, a vote then. All in favor, say aye.
Aye.
All right, and the motion carries. Before finishing up this evening, yes, we did, board members wanted the opportunity to speak to the public on record regarding what's happened the last 7 to 10 days with respect to Executive Order 2 and the New Kent County Public Schools communication regarding such. That led to the executive order going into effect today, January 24th at our school. So board members, if you don't have comments, you don't have to speak, but if you would like to, this is the time to do so. I will start to my right. Ms. Barber, if you have any comments, please go ahead.
Yeah, I have 2 points to speak to. First of all, we all want in-person learning. We don't want that to be interrupted. And we have that right now, and we have it based on the scenario that was in place last week. So why would we change a variable and introduce an unknown that is probably not going to make things better? We're in a COVID surge that we're at a 30% rate of transmission, which is higher than it's been. And we think the peak of that surge is close and will fall off. If we introduce this unknown variable, does that stretch? And can we weather that with the staff that's already stretched thin and overworked and students that are trying to stay in school to learn? So I think changing that mitigation strategy at this point is not the best thing to do. It should happen after the surge when we can recover. We have the staff available. Again, I don't want to see learning loss. We've already seen learning loss, and parents don't want their children to get further behind. And that is the most important thing. Keep them in school, keep our staff happy and doing what they want to do. I just think by doing that, it changes something that is going to impact us to a breaking point. I'm sorry, Andrea. I have a second point too, because with regard to parental choice, I had two students that went through the schools. I understand the importance of being able to make decisions for my children. And again, if we take away, if we, put our families in the position where parents that want their children to wear a mask, and we know what children are like, they're going to get off the bus at school, their parents are nowhere to be seen, they're going to make the decision to whether they wear the mask or not. And I think that's, I've spoken to a number of parents of students that are concerned about their children bringing the COVID home because they made a choice for themselves instead of following their parents' wishes.
Ms. Daskill?
I share Sarah's concerns. We've heard from teachers and parents
all over our community, people with children and without children and grandchildren in our schools. And it's clear that everybody is going to have an opinion, no matter what. There will be unhappy people with any decision that's made. The fact of the matter is that we are currently teetering on not having enough staffing on any given day to even keep the schools open. We all know that last Friday was almost a no-go due to staffing if we hadn't closed for snow. I work in healthcare. I'm a licensed nursing home administrator and executive director at a nearby retirement community. Our local hospitals have the highest number of hospitalizations due to COVID that they've had since the beginning of the pandemic. Our schools in New Kent are full and at the elementary level are above recommended capacity. I'm afraid that removing masks will put us over the edge and force us back to virtual. I believe that having kids physically in school and not virtual needs to remain the priority. I think and hope that within the next month, the numbers will be improving and we will be in a much better position for masks to be optional. It is for these reasons that I'm making a motion tonight to require wearing masks in New Kent County Public Schools effective immediately.
Okay, Ms. Gaskell, thank you. Ms. McBee? If you have comments?
Yes.
Sure, please go ahead.
Thank you, Dr. Nichols, the leadership team and staff. I realize it's been very challenging over the last, since being in the school, and I really appreciate that. As a New Kent County School Board member, I took the oath on January 12th to legally uphold the rule of law. We have an executive order by the governor of the state of Virginia. And as a board, we have followed all health mandates issued in the past, and I believe this one is no different. As we enter the third year of the COVID pandemic, there have been so many controversial issues that have polarized and divided many in our community. And our schools have not been immune to this. Mask policy is just one example. We all know the purported benefits associated with requiring masks to be worn, but little weight of concern seems to be given to the negative consequences, especially for our younger students who benefit from nonverbal social interactions. Foundational strategies that are found in the CDC Guidance, such as testing, vaccination, and staying home while sick, can help reduce school transmission. From a parental role, masks may or may not play a part. However, that is up to our parents who are in charge of their child's health and well-being. This also applies, I believe, to our staff and educators. From my perspective, after listening to those in the community, Dr. Nichols' feedback, and my own access and discussions with healthcare professionals, I believe this is the best path forward. The good news is that we are in a very different place than we were 24 or even 12 months ago. Testing is available, prevention is available with vaccines, and treatments are available, including monoclonal antibodies, and now 2 different pill regimens that have been shown to prevent serious COVID infections. With this in mind, I believe our children should no longer be required to accept the harm of masks. And I think we're finding, as you cited today, your children are showing up with masks on, some are not. However, that's the parent's decision. So.
Ms. McBee, thank you. Mr. Mead?
Yeah, I appreciate Ms. Barber, Ms. Askell's comments, and I do respect them very much, and I do hear what you're saying. And my challenge when this order came out was, it was just that, it was an executive order. And I am mindful that back on March 13th, when COVID became an issue for the public school system in the state of Virginia, is we were at a point where, well, it was a true unknown. And based on the unknown, with no scientific data, with no medical information whatsoever at that point, at that time, the current administration decided to shut down the entire public school system in the state of Virginia. And we know from historical evidence from that time, from March until June, the infection rate was nominal or almost not even statistically showed up on a map. And until that summer is when it started to peak. And so every school division in the state of Virginia complied with that executive order without any scientific evidence. And then this past year, the health commissioner came out and made another executive order, which we interpreted as a board as law to comply. And my concern is, as a board, and I'll go back to Ms. McBee's comment, that we are bound to follow the law, and an executive order in the state of Virginia constitutes just that. And so I feel compelled as a school board member, we're either going to comply with all the executive orders or we're going to comply with none of the executive orders. And so under this current administration, he made an executive order. And I feel compelled to comply with that executive order that gives parents the option for masks. And I'll be honest with you, I am based on the information that Dr. Nichols said, that 75 plus or 80% plus students or teachers have chosen to wear a mask. And I support that 100% because that is the parent's choice. But I think that for me, in my opinion, it goes back to an executive order. And for all of us sitting here at this table and those that are public, is that we shouldn't be surprised. This current administration told us what was going to happen. They prepared us with what was going to happen, and we knew it was going to happen. And so when the executive order came out, that's why I was compelled to say, and he could have said whatever he wanted to say in his executive order, and I would have complied with it, because that is the rule of law that we are bound to follow from a governor. And so that's why I support the governor's executive order number 2 that says that masks should be optional for students based on the parent's prerogative of sending them to school. And so again, I want to thank our parents and our staff, and I know it's not an easy task. I know it can be overwhelming. And I'll go back to Mr. Miller's presentation. The way that we got to Mr. Miller's presentation was because of parental involvement. The current administration got to their decision because of parental involvement. And the more that parents get involved in the process of local and state government, the more that we as elected officials will hear the will of the people. And if we hear the will of the people, then we are compelled to follow that, in my opinion, based on the oath that I took to follow executive orders by the governor.
Okay. Thank you, Mr. Mead. And I'll include my comments. It was 1 year ago yesterday here at New Kent High School that New Kent County Public Schools, in partnership with the Chickahominy Health District and New Kent County, held its first COVID vaccination clinic. At that time, I was confident personally that the vaccine was the solution. Dr. Nichols, I do grasp the weight of the matter before the school board. I recognize the challenging work your team does to serve and support families during the pandemic. Everything from school closures to virtual learning to hybrid learning to hotspots, ever-changing COVID mitigation guidance, and many more challenges that only someone directly involved with the schools would understand have come before you and your team. Procedurally, just as the New Kent County School Board did not vote and complied with the August 12th, 2021 Order of Public Health Emergency number 10 that mandated the statewide requirement to wear masks in K-12 schools, New Kent County Public Schools communicated to our families last Friday on January 21st that the division would comply with Executive Order 2 that terminated the Order of Public Health Emergency Order 10. EO2 did not give local school boards the authority to decide on this issue, as we had anticipated. There are parents, teachers, and students with passionate feelings on both sides of this issue. There's anger and there's fear. Our role as school board members is not to choose who we care most about or whose fear is most valid. Our disagreement is on the most lawful way to proceed. This is about being faithful to the oath taken as school board members to protect the Constitution of the Commonwealth of Virginia and to adhere to the rule of law. Please consider the timeline. Last year, on August 5th, Governor Northam stated in a press conference that masks would be required in K through 12 schools for the upcoming school year because of Senate Bill 1303 that required schools to offer in-person learning, but also stated that they should follow CDC guidance to the maximum extent practicable. That explanation was unconvincing for many and created a period of uncertainty. So a week later, on August 12th, Governor Northam and State Health Commissioner Norm Oliver issued a public health order mandating masks in K through 12 schools. Governor Northam's administration did not think that SB 1303 mandated mask use and instead needed a public health order to do so. Governor Youngkin's Executive Order 2 forbids mask mandates. That means that following the CDC mask recommendation is no longer practicable as a mandate. However, masks are allowed as optional if desired. There are 36 states in our country that have been mask optional since September. So Virginia is not an outlier here. This is an extremely divisive issue, and I look forward to when we can focus on other things for our students and teachers. Thank you in advance for giving grace to our teachers who are doing the best during these almost impossible times to make things work for our students. Okay, Ms. Staskill, you made a motion. Can you go ahead and repeat your motion, please?
I'm making a motion to require wearing masks in New Kent County Public Schools at this time and reevaluate monthly based on numbers.
Okay, board members, this was not an action item on our agenda, just to note that for the meeting minutes, that there is a motion on the table. Board members, do I hear a second?
Second.
Okay, second made by Ms. Barber. Board members, any discussion? I think we've already had our discussion. I'd like to take a vote then. All in favor, please say aye.
Aye.
Okay, we have 2 board members voting in favor. All opposed, say no.
No.
No. So we have 3 opposed. The motion does not carry. Last item is to adjourn. Our next meeting will be our February monthly meeting on February 7th. With that, our meeting is adjourned at 8:04 p.m. Thank you.